And thank you, Chair, and thank you, AIOC, for giving me this opportunity. Regards from and well wishes from Bangalore, from Ramaya Medical College. To introduce, there is a definite rapid growth of Indian medical education system. From 270 colleges in 2008, just in 12 years, we have doubled the medical colleges in India. This will exponentially increase as this budget says that the government plans to change all district hospitals into medical colleges in the state. India has the highest number of medical educators in India, in the world. So let's go into the world scenario. How did it all start of teaching and learning? 5th century, students were like apprentices. They used to come sometime, work with a person who knows a little knowledge about medicine, and then go back and do his other works. So it was a part-time job to learn. On the 10th century, there was little significance of pre-academic teaching, which was more common in Italy, where mentorship started. And in the 16th century, with books coming into play, they emphasized more about observation and measured experiments. On the 18th century, we graduated to hospital-based clinical medicine. We see this University of Illinois, where we have a MOU with Ramaya Medical College. We have staff exchange programs with them. And in the 19th century, experimental methods started, and specialization and lab-based teaching also started in the 19th century. But now in the 21st century, we have Advanced Learning Center. This is Advanced Learning Center of Ramaya, which was picked at 2015, where Professor Dua was there with us. So this slide doesn't need any introduction nor the heading. We have the 4 great doyens of teaching in different subspecialties of the world of ophthalmology: Von Graffe, Sir Duke Elder, Charles Creepens, and then Jose Baraker for the corneal. Indian scenario from the world, we get down to India. Ayurvedic medicine, as you know, is a very oldest part of teaching, where practiced in 2000, 3000 before Christ. Guru Shishya Parampara, this is a Brahminical system wherein an individual training of students was done by skilled practitioners. Then we led into allopathic system by the missionaries who came in the 16th century to the soil of India. And the first medical school was started in Calcutta in 1824. 1881, there's some more history. Meritorious students were admitted in Bombay and Madras to become hospital assistants. 1917, where our state had a Mysore Medical School, which is called, started to train sub-assistant surgeons. So you see the difference. Still the doctor thing is not come yet. These trainees had to undergo 4 years, and then the first degree licensed medical practitioner was given to them. 1924, the Mysore Medical Schools upgraded to Mysore Medical College. So this is a photograph of Nagpur in 1870, where you see the graduates with the teachers. This, without touching this momentum, this building, nobody can tell a history of ophthalmology. This is Egmore Eye Hospital, Regional Institute, which is the second one in the world to be set up only for exclusive, other than Moofield Eye Hospital, which was the first. This structure was the first in the Indian subcontinent as well as in Asia. And without touching this RP Center, nothing is. This is the largest volume of postgraduate students education nowadays. It is about average of, it's an average, sometimes it is less, sometimes it's more. Every 6 months there is an intake of 19, and this also is an apex body of all the programs of India. It is distributed to other parts of the India like NPCB. Knowledge transfer, teaching helps in knowledge transfer, that we all know, essentially for the maintenance and advancement of health care system. Delivery of the factual knowledge about the topic and exposure to tools. Teaching also helps in development thinking processes required to make critical decisions with the information what is in hand. Pedagogy, this is a teaching methodology where practice of teaching, especially as an academic subject or a theoretical concept. Traditionally, medical teaching, as you all know, is a combination of didactic lectures and in the classrooms, and then there's a Socratic method where we take the students to the clinical settings and teach them. Merits of didactic lecture, as you all know, is a traditional delivery of a factual knowledge. Very large group, nowadays 350 students are in a classroom. A large topic can be covered very short time, there is no interaction, so the teacher keeps rattling out what all he knows in that subject. Demerits of didactic, a more passive way. There is no check of the listener whether he has understood the topic. Lectures do not correlate with shortest attention span, subject to a speaker. So a good orator as a teacher would deliver a very, very good lecture than a person who is not having some oratory skills. Self-learning is a must in all teaching learning, because self-learning is the one which emphasizes on what you know and how to write your exams. Challenges: the rapid growth of medical education in India. Three major issues are happening. Standardization, quality of medical education across the India has not happened so far. The newer medical system, the newer thing which started this year has this standardization. Implementation of effective solutions to address an artificial, there is a definite, as you know, like practitioners, the teaching doctor also is unequally distributed from tier 1 to tier 2 and tier 3 cities. Formal teaching of teachers in medical school has not happened so far. Even to start with first grade or second grade of schooling, people have M.Ed and B.Ed degree, but there is no special training for any medical teacher or a degree before they start that training. Medical college, as you know, undergraduate is about 1 year of ophthalmology, postgraduate 3 years, now DOs are not there, and fellowship is in subspecialty starts from short 2 months to 2 years. Advancement in this is that the Advanced Learning Center, we have one good one in Ramaya. Hands-on workshops can be there, and cadaveric lab is also present. There's definitely faculty exchange program between the universities, and PhD in different universities are also got in subspecialties. Definitely going ahead, e-learning is the key. Use of internet technology to enhance knowledge as well as performance. E-learning is centered according to the learner, not according to the teacher. So learning sequence he can adjust, and pace of learning and time and media content also is adjusted by the learner himself. An effect as a traditional instructor method, as effective as it as a lecture. Provision and for having a whole library in a single device, so you can see the even the huge books, and the spinal cord is relieved of all this heavy carrying. Combination traditional teaching with e-learning is a must. Socratic method with in the scenario for the hospital, and online learning helps in enhanced student motivation and self-confidence. There are definitely, you know better than me, online websites are there, and Facebook, Instagram, Twitter for eminent ophthalmologists, for nothing else other than that. Self-learning using search engines as well as webinars. Now we have a lot of webinars coming in, and live surgeries also beamed across the country and the world. E-learning merits instant access to knowledge, anytime, anywhere. Diverse literature is there, and online journals, courses and tutorials, all available in a single click. Definitely there is demerits, a lot of authors, lot of lecture, and you have to choose among the best. Comes with a lot of distractions, and provision of effective e-learning is not cheap at all. So the facilitators for these learning and teach is gurus in the first place, and mentors, and then we have teachers and consultants in the hospital setup, and senior counterparts are the most important facilitators, as we all learn from our senior postgraduates. And definitely now going on to the online sector, we have cataract coaches and online gurus. So in conclusion, medical teaching is constantly evolving. Pace of medical college growth should match with the pace, with the adequate availability of a mentor, or a lot of mentors are necessary. Focus on all areas of learning, like self-learning, didactic lectures, as well as mentorship, and application of e-learning is a must in all the above areas. And as William Watt said, a mediocre teacher just tells, a good teacher explains, a superior teacher demonstrates, but the greatest of the teacher inspires. Be a learner, be a teacher.